Campos from Mexicali Bariatric Center. In all the revisional surgery, we try to have a previous X-ray or a barium swallow. The reason of having an X-ray or a barium swallow before surgery, it's quite important because we can review the anatomy of the stomach. We can take a look of how's everything flowing or how's everything running. It's a quite simple procedure. Normally we do it the first day before surgery when you arrive here in the hospital, so we can do all the lab work, chest X-ray, and plus, in this case, having a barium swallow. Barium swallow is the same leak test that we'll use after surgery, but in this case we do it previously to the surgery so we can review the anatomy. Normally the first thing that we want to see is your esophagus and the size of your stomach. For example, if you already have a gastric banding, we review that your esophagus is not huge or is not distended. Normally with a very close gastric banding, we can have a stomach very tight, or we can have in slippage, or we look for erosion. The other thing that we must check is the size of the stomach, especially on a gastric sleeve. We must take a look that the sleeve is very well defined, that the esophagus is on a nice proper shape, that we don't have a huge fundus, for example, or that the stomach on the lower part is not huge or is not very big. So for example, sometimes we cannot see the full size of the stomach, but we can see some signs like this air bubble on the top of the stomach. That shows that the stomach is getting enlarged. If we see that we have like a butterfly wing on the top and we have a butterfly wing on the bottom, that's basically a very enlarged antrum and a very enlarged pouch on the top. And that means that the stomach will grow on the longer run. In that case, adding malabsorption is not only advisable, it's basically reconstruct that sleeve and then add malabsorption. So when we staple and cut the stomach, we over suture it again, and then we check that the stomach is in the proper size, and then we can add malabsorption.